study, you look with the right eye at the dot and the plus disappears, or you could look with the left eye at the plus and make the dot disappear, and as you vary S, you get a relationship that's going to look like this. The data are going to fall, so we're going to plot the separation is between the dot and the plus. You vary, and the dependent variable was D, the distance between the eye and the face to make it disappear. The points will fall on a straight line that goes through the origin, and so the thing to explain is why did the data come out as a straight line going through the origin? And why do we have to reverse the roles of the dot and the plus for the left eye and the right eye? So let's see an explanation of both of those. So here's the two eyes as seen from above. And here's where the optic nerve, here's the fovea. So when you look right at something, so here we are looking with the right eye, when you look right at something, it goes onto the fovea. And here's the dot, and here's where the optic nerve leaves the eye. Here's where the optic nerve leaves the eye on the other side, so here's our optic chiasm we've been talking about with respect to the split brain stuff. Anything that projects onto the optic nerve, that's also where the blood vessels come in. I showed you what it looks like if you actually look into somebody's eye, which your eye doctor will do, your ophthalmologist or your optometrist if you're having your eyes tested for glasses. They'll do a preliminary investigation. So anything that falls on that line is going to fall onto the blind spot and disappear because there are no detectors there. There's no retina there. That's just where blood vessels are coming in and where axons are leaving the eye. So anything that's projected there is what disappears. This is where when you're looking right at something, like the dot, it's projected onto the fovea. And anything that's projected here, that's the blind spot. And so here's the plus. And so this is the separation S. And we have light traveling in straight lines. We're using the pinhole model that I went over with you last time. Every ray of light goes through a point on the front of the eyeball. So we can construct a triangle here. Here's a right triangle whose angle is alpha. Here's a right triangle whose angle is alpha because we have two straight lines. The opposite angles are equal. And so this triangle down here is similar to this triangle, or actually to this triangle, or to this triangle. These are all similar triangles. They're all right angles with the same angle alpha. And what do we know about similar triangles? We know that ratios of corresponding parts of similar triangles are equal. So that means that we know that S1 divided by, this is D1, is so S1 divided by D1 is equal to S2 if this is S2 over here, and this is D2 divided by D2. Or we can just write it as S divided by D is equal to a constant K, because these are all similar right triangles. So anything, if we go twice as far away, we have to separate them twice as far apart. So this is basically your geometry from junior high and from that sophomore year in high school or whatever it is that they require for admission to the university here. So S divided by D is equal to K. So we can multiply both sides by D and we get S is equal to K times D, and that's a straight line that goes through the coordinates 0, 0. So that's why it's linear. Now why do we have to reverse it? Well, in this eye, so notice the thing that disappears, in this case is the plus. Now if I look at the plus, anything that falls on this line, like the dot, is going to disappear. So in order to make something disappear in the left eye, it's got to be to the left of what I'm looking at. To make something disappear in the right eye, it's got to be to the right of what I'm looking at. So that means with two eyes, with this arrangement, something won't fall on the normal blind spot with both eyes. So if you've got two eyes, something won't disappear. And that's why we don't hire. Everybody clear on that? So this diagram shows you why you reverse it. You reverse the roles in the left eye. So that's why we don't hire a pirate to be a bus driver for school buses, right? Because what do we know about pirates? That's right, Kyle hasn't even heard this lecture, but he knows that they have a patch on their right eye, and a hook, and a peg leg, and a parrot, right? And all they can say is, "Arr." But at least they can get a job, because anybody can program an "arr" can get a job these days, right? All right, so, but they shouldn't drive a school bus. And why is that? Because they're driving along with a patch on their right eye, looking straight ahead, and that truck that's about to turn left can disappear. If you're looking straight ahead, what's to the left? So this person is looking straight ahead, you got a patch on the right eye. This truck that's about to turn left into the path of the school bus just disappears. Now the farther away it is also, because anything really, it isn't just this point, it's anything inside this cone. So as you go farther away, the size of the blind spot out in space, it can be a bigger and bigger object that will fall completely onto the blind spot and disappear. So from where you're sitting, the blind spot, might be this big, but if you're driving, it could be big enough to cover up the whole truck. So the whole truck can fall into the blind spot and disappear, as seen from the driving standpoint. All right? So how many got this one here, number one? So basically it's the geometry, it's the fact that light travels in straight lines, and we get the pinhole model. So here's our first use of the pinhole model. Got the reason for it to reverse is that the optic nerve leaves the eye immediately with respect to the fovea. So what you're looking straight at, the blind spot is toward the midline, in the left eye, and toward the midline in the right eye. So what's in the blind spot is to the right of what you're looking at in the right eye, and to the left of what you're looking at in the left eye. For the homework, the question was, can something fall into the normal blind spot in both eyes? And the answer is no, because it can't be both to the right of what you're looking at and to the left of what you're looking at the same time. So if you have two eyes, something won't fall into the blind spot. Khaled asks you to do the little demonstration in the book of Khaled where people fill in. So if you have a pattern, people don't see a hole in the pattern. So if you're looking at a pattern and you look at a point on the pattern, people fill in the pattern. So the brain just fills in. If you're looking at like wallpaper or something with a pattern, you won't see a hole. If you're looking at a spot on a wall, the brain will fill in the pattern for the missing part. I think that in some of the editions there's a circle with a lion tamer and the lion disappears, but the circle doesn't seem broken. So where the lion is disappears. People see the circle filled in, so he's got it illustrated. Some of the editions, a little bit different artwork. How would you find another blind spot? Well, many of you have probably had the test where they're looking for blind spots. So you go to your optometrist and they will probably run a few standard tests for your vision. One of the standard tests, they may put drops in your eye and actually press on the eyeball to measure the pressure inside your eye. They're checking for glaucoma, so that's a serious disease that can damage your vision, eventually producing blindness. The blindness is progressive, so you get to where you can see, tunnel vision eventually, but you begin to lose periphery, and then it gets smaller and smaller and smaller until it's almost like you're looking through a tube of paper. The person has to move their eyes around. So glaucoma is a progressive blindness disease. If the pressure inside the eye is too high, there are some drugs you can take to deal with it, so it's a test that's worth doing, and they would do a test for it. Another method is a real simple screening method. They don't need to put drops in. You put your head into a machine and they tell you to look at something, keep your eye open, and they go psh, blast you with a little puff of air, and you feel it and you blink, and They can read off, they bounce the air off the eyeball, they get a quick reading, it's not as accurate as actually pressing on it. So if they get a misreading, they'll send you to, they'll put drops in and they'll actually press on it and get a little bit more accurate reading. They may send you to an ophthalmologist. If you go to an optometrist, they're measuring you for glasses, but they would do screenings for eye health. They will send you to an ophthalmologist who's an eye specialist for dealing with vision problems. They may look in. When they look in, here's the retina. We're going to finish up what we were doing with the retina last time. This diagram is showing that there are several layers. There's cells back here in the back of the eye. So this is the back of the eye, and these cells are holding onto the rods and cones. There are the bipolar cells. There are also some amacrine cells involved in lateral inhibition here, and horizontal cells involved in the inhibition and excitation of the cells with each other. The bipolar are called bipolar because they have two ends, and these are the ganglion cells that send their axons to the optic nerve. Then there's the blood vessels that come in through that. I showed you that diagram of what it's like to look into the eye and see where the blood vessels come out. The light comes from this direction. So that means these blood vessels are casting their shadows on the detectors of the light. You don't see the blood vessels, but you have probably seen the blood vessels in your eye without realizing it when they look into your eye with an ophthalmoscope. So remember, when you look into somebody's eyes, it looks black when you look in the pupil because your head is blocking the light that goes in there and allows me to see in there. But if you have a source of light right next to where you're looking in, as with the little cameras that take the demon eyes, the red pictures, you can look in there. And so one method is to use an ophthalmoscope, and it has a silvered mirror and a source of light that shines through, or a prism that the light comes up and bounces off the prism, but you can look through the prism into the eye. So with this device, I can look into somebody's eye and see the blood vessels and look around the periphery, look for evidence of damage in your eye. And when they move the flashlight, as they're shining that light into your eye, they'll be telling you, look up at the ceiling somewhere. So you're back in this chair, your eyes open, and they're shining a bright light in there, looking around, looking to see if the retina is detached, or if you have a tumor, or if there's a herpes infection, or if you have signs of diabetes or other kind of problems in the eye. So they're looking in there, shining, and as they move that flashlight, the blood vessels move, and you will see the shadows of the blood vessels in your eye move across. So what look like rivers and tributaries move, and then they disappear. Anything that's stabilized on the retina disappears. Okay? So you will see the shadows of the blood vessels in your eye. I've been thinking of writing a country western song with a title like that, The Shadows of the Blood Vessels in My Eye. But I haven't yet worked out what rhymes with that. But you can see those shadows of the blood vessels in your eye yourself, but it takes a little technique. So you can buy like a pen light, a little light, go in a sort of darkened room, and you kind of flick it. It's when you move it that the shadows will move, and you'll see the rivers and tributaries of the blood vessels. You'll see the shadows of them as they move a little bit, but you have to kind of flick the light. When you shine it in, you just hold it. You don't look straight at the light. You don't need to. You just shine it in through the pupil into your eye and kind of flick it. And so the technique of flicking is what makes them move and allows you to see them, see the blood vessels in your eye. So I recommend that, and you will pay attention next time you get your eyes. How many of you had your eyes tested and gone to the ophthalmologist or optometrist and had your eyes tested, and they'll shine that light in? Next time they do that, pay attention. Another time you'll see them is when you're in an absolutely dark room for some reason. College students like situations like that, I don't know, completely dark room, and then suddenly turns on all the lights. It turns them back off again suddenly, and you see all the blood vessels. You'll see after images of all those blood vessels, so they'll be out there in your visual field, after image of the blood vessels lit up along with everything else in the room. All right, so pay attention to that next time you see it. Now, how do you find another blind spot? Well, when you go to get your eyes tested, and so when you do that, you'll also get your check for glaucoma, and they'll pay attention to see the shadows of the blood vessels. They may also have you look into a box. They do it different ways, but one method is you look into a box, and then they give you a little button to push. And every time you see a little light come on, or maybe it'll be some little wiggly lines that'll appear somewhere in the visual field, they have you look with one eye, and they'll tell you look at a fixation point. There may be a dot for you to look at, or a little plus or a marker to look at. And then lights will appear some other place in the visual field. Each time you see one, you push the button. Get a printout of it. Ask them to give you a copy of the printout if you can, because they'll print it out and give it to the doctor, but they may throw that piece of paper away, and they may give it to you, and you can look at it, and it shows your test results. Hopefully, there are a number of things they're looking for. So everywhere the computer is going to present at different places, the lights will appear. So let's say this is what you look at. Well, let me put it in a circle. So that's what you're looking at. And everywhere you see something, so let's say you're looking with your right eye, everywhere you see something, they will score a plus. And everywhere you don't see something, they will score a minus. And this is normal, that you should have something like this, because this is the blind spot, right? So when they flash something on the blind spot, you should not detect it. They'll also run some checks for false alarms. That's when you push the button when they didn't do anything. So they will check for false alarms. But a normal person will have pluses everywhere, or depending on how the printout looks, maybe they will present each point 4 times, so you'll have 4s, a bunch of 4s there, and maybe there'll be a 3 because you missed one somewhere. And then you'll have 0s right in here. This is where the blind spot is, that's normal. You'll also have a 4 here and a 4 here, which means on both sides of the blind spot you can see. But if you're developing vision problems, you may have all minuses over here. This might be a sign of glaucoma, and minuses over here where a normal person, so your vision is getting smaller. You should be able to see something on both sides of the blind spot here. And this tends to be progressive blindness, works this way, where you begin to lose it to the right over there. So when they do that test, they may tell you everything was okay, but you say, could I have a copy of the printout? Maybe it's only in the computer and they won't print it for you, so you may not be able to get a copy of it. If you're going to an ophthalmologist, the person who runs the test may be an assistant. They will print it out and give it to the doctor. The doctor will probably throw it away because they have it in their record. You can ask for it, they might give it to you, so you can keep a copy of it. All right. So that's how to find another blind spot, is by means of that test. There are other things you could do. You could talk about, you could vary your distance and rotate this around at all angles and see if you can see see under what conditions the plus will disappear. So simply by rotating it and varying your distance, that would be a cheap way to do it, the way they used to do it in the old days. So what might that mean? What could cause another blind spot? Looking at the sun during an eclipse, or exposing yourself to certain drugs. I mean, a lot of things could, diseases like herpes infection that could kill part of the retina, things like that can happen. Glaucoma can produce these patterns I was just describing. Other conditions, diabetes could produce places where a normal person would be able to see, and a person with the diseased condition might develop a blind spot. LSD might produce some temporary blind spots, if it's a low enough dose. All right, loudness is to pitch as brightness is to hue. So you want to get those kinds of, or wavelength is to pitch as wavelength is to hue, or amplitude is to loudness, as amplitude is to brightness, or there's a whole lot of analogies you could make from that table that I gave you last time. Any questions about the quiz? All right, or the homework?